I wanted to show you this slide because at a time when the Canadian Medical Association was being beset with all kinds of internal and external pressures to say private health insurance is a good thing, it's the way to go, this was their actual conclusion, is that it can provide greater choice and access to services for those who can afford it, but it's not been found to improve access to publicly insured services, lower costs, or improve quality, all of which are claimed for a parallel private system. And the evidence from around the world is that that, in fact, is a false assumption. There are tons of them from various places around the world where they experimented with the idea of choice, competition between hospitals, which led reasonably predictably to anyone, the sentient human being, that in fact what you would end up doing is concentrating wealth in the hospitals, so that you would have specialized hospitals and rural areas would suffer and distribution would suffer and so on. And the British Medical Association, you know, that well-known Trotskyite organization, has unambiguously come out and said that it's a failure, that the introduction of that kind of market mechanisms in the health system was a failure and should be reversed, because they see it from the front line, and that's what I've been asked to give a perspective on.
So one of the major things Medicare did was it limited the acceleration of funds going into the healthcare system. It also transferred the burden from, in shorthand, the unhealthy and unwealthy to the healthy and wealthy, because when it's tax financed, then it's going to take a larger proportion of the income of people at higher incomes.
I think we can say with reasonable certainty, and we can expand upon this, that privatization introduced into the Canadian healthcare system, and we have to be careful that we don't get too tied up in international comparisons, because our system is our system, and that's what we need to be working with. Privatization will almost certainly increase the costs, and disproportionately load them onto the lower end and the sick. It will lower the quality, and even the private parallel system in Britain consistently delivers lower quality, which is kind of ironic when you think of people buying their way into supposedly better care, actually getting less good care in that situation. It will lower access, and as has been demonstrated in Australia in a similar system, and it will be unquestionably less equitable. And I want to keep coming back to that issue of equitability. So our job, I think, collectively, is to calm the panic and make wise choices.
The problem is not a problem of insurance. Well, collectively, we can decide to spend more or less on different sectors, and we seem to agree with everybody else in the world that it makes sense to invest in health. This is fine. If we want to invest in health, there is one way to fund it, which has been proven to be better, more equitable, more stable, more sustainable than any other single way to fund healthcare. It is a universal, publicly administered insurance system. This is what we have. This is among the best. This is the best way you can fund healthcare from.
In terms of administrative costs, you know, you raise a good point, and I think we'll probably talk about it more tomorrow, but as they bring in all of these market mechanisms, as they bring in all of this hyper, you know, administration and measurements for everything in hospitals, we are seeing vast increases in administrative. You know, one nurse was telling me the other day she worked in the London hospital, and there used to be offices in the hospital for administration, and now they have their own building, multi-floor building, to house the administration. And because hospitals are competing on how fast they get patients out, how few staff they have to measure all of that stuff. And then if you add in the pricing and bidding systems and all of the rest of that they want to bring in BC and Alberta and Ontario, of course that siphons all that money away from care.